Hi, my name is Judith, and today I'm gonna meet Mr. D. Mr. D is a patient that has been on hemodialysis for about a month. I have his chart here with me, and it says that he's a diabetic patient. He has an arteriovenous fistula. His lab results shows that URR are 55 to 60%, according to the lab results. And he's been able to tolerate 2.5 liters of fluid removal in the past treatment, well tolerated, unfortunately without reaching his estimated dry weight of 80 kilos. Let's go and meet Mr. Hi, Mr. D. My name is Judith, and today I'm gonna be your nurse. How are you doing today?
I'm doing better, thank you.
Good. I'm gonna start by doing an assessment, starting with your blood pressure. Okay, let's put this in your arm. You're gonna feel a squish for a little bit. Okay, your blood pressure is 187 over 98. I'm gonna check for your temperature. Temperature is 36.8. I'm gonna check for your respiration. Okay, your respiration is 26. And I'm gonna listen to your lungs. Would you mind to lean forward a little bit? Can you deep breathe in for me? Again. One more time. Good. I'm gonna also listen to your heart. Good. Your heart rate is 105, and your lungs. Would you mind to step into the waiter, and I'm gonna check for your weight. Okay, you have 84 kilos. Okay, you can sit please for me. Do you have any shortness of breath, Mr. Dean?
Yes.
And when you walk long distances or you climb the stairs?
Yes.
Okay, I'm gonna check for your legs. Both legs, you have swelling in your legs. Any skin tear, any wound?
No.
Have you noticed any bleeding?
No
Gum bleeding, bleed in your stools, urine? No?
No.
Any recent surgeries?
No.
Medications? Any new medications?
One of my blood pressure medications have been removed. I don't remember which one though.
I'm gonna check on your chart and I'll let you know which medication, okay? Okay, Mr. D, based on your results, like you said, you feel some shortness of breath, you have swelling in your legs. I could hear some crackles in your lungs and your lower lobes of your lungs. You have fast heart rate, a little bit fast, respiration rate, and your blood pressure is also elevated. All these symptoms are related to fluid overload. Mr. D, I'm going to explain you a little bit more what is hemodialysis, a treatment that we'll be using for cleaning your blood. This means that you have this treatment 3 times a week, 3 hours a day. You will come to the clinic. So far you've been doing it for a month. So when you come into the clinic, you will be connected to the dialyzer, and the dialyzer will remove all the fluid, toxins, solutes that your body doesn't need. Usually a normal kidneys will filter your blood 24 hours a day, 7 days a week. But in this case, we're doing it just 3 times a week when the kidneys are not working properly anymore. Okay? So, what do you expect about hemodialysis? What are your expectations, Mr. Tim?
I hope to feel more energetic and to be healthier and to also have enough energy to do more activities.
Yeah, excellent. So in that way we can help you to achieve all those goals by choosing the right treatment for you. In your end, you also have to do some extra work that will help you to achieve those goals. For example, limit your sodium intake. that will make you to reduce your fluid intake. And I see that you have 2 glasses of water.
Yes, I've been feeling really thirsty. That's why I have them.
Yes, for sure you're gonna feel thirsty as a diabetic patient, so you will always feel thirsty. But we have options that will reduce that feel by we have options such as ice chips that will last longer. You can also chew gum. You can have mouth rinse your mouth with mouthwash, and you also can have some frozen fruit that is low in potassium that will make you feel satisfied.
Like
So,
grapes?
like grapes, exactly. So I will. You also need to reduce the sodium. The less sodium you have, the less thirsty you will feel. So I will also like to involve a dietitian that will help you to build the right diet for you. Would you like to do that?
Yes.
The dietitian to help you to choose the right food and will help you to achieve your goals. Excellent. Okay, Mr. Dean, I'm gonna explain you what type of the dialysis you're using. You're using the Ribomax 400 dialysis, which is based on your biocompatibility. This will also help you to remove the solutes that you need to be removed. Your estimate dry weight today, your estimate dry weight is 80, but today, as we weighed you before, is 84. Plus the glasses of water you have, and plus the rinse back will make a total of 85 kilos today. In our unit, we usually remove 1 liter per extra kilo, but you've been able to tolerate only 2.5 liters. So I will need to talk to the nephrologist to verify if we can increase the removal of fluid. You also will have 3K 1.25 dialyzed bath. It's going to be for 3 hours. As I told you, your sodium will be 140. The dialysis rate will be 500 ml per minute, and the dialysis temperature is going to be 36. You're gonna be direct connection. You're gonna have direct connection. Your heparin, you will have heparin since you don't show any signs of bleeding. Of 2,500 boluses and 1,000 continuous rate with a 60-minute shut off, which means that 1 hour before you're done with the treatment, we will shut off the heparin, so you're not gonna have problems with your arteriovenous fistula bleeding. Okay. The blood rate will be a maximum tolerated, and in this unit we do 400 ml per minute. And since you're gonna use your fistula, I wanted to assess your fistula today. So I'm gonna start looking your fistula. I noticed that you don't have any redness, any open areas, or any swelling, which is good. Now I'm gonna listen for a breath, and I'm gonna auscultate, and I can hear a continuous turbulent flow, which means that no stenosis and your fistula. Finally, I'm gonna palpate your fistula. I'm gonna palpate for a thrill, and I can also feel you have a continuous turbulent flow, which means that is not a stenosis either. I'm gonna do 2 tests for you. One is called augmentation test, which means that I'm gonna put pressure on the midpoint of your fistula by palpating the thrill, and with this I'll make sure that I can feel the flow of your blood, and it feels okay. Finally, I'm gonna do an elevation test, which means that I'm gonna elevate your arm above the level of your heart, and I can see that your fistula flap goes down, and that means that you're getting your freely blood flow back to your heart. Okay, Mr. D, your fistula is ready for being used, and I'm gonna talk to your doctor and I'm gonna go back to you. Okay?
A few moments later.
Hi, Dr. Kim. My name is Judith, and I'm calling you regarding Mr. D. We are about to start his hemodialysis, but before to start, I would like you to inform you about his findings. Today, his weight is 84 kilos. His estimate dry weight is 80 kilos, so he's 4 kilos more. His temperature is 36.8. His blood pressure is 187/98. His respiration rate is 26, and his heart rate is 105. I also noticed some swelling in his lower legs, as well as some crackles. I could hear some crackles in the lower lobes of his lungs. So all the symptoms are related to fluid overload, as well as the extra kilos. So I was thinking to have increased the target fluid removal for him today to 4 liters. Okay. Yes, I did provide teaching about restriction of sodium, restriction of fluid intake, and I also advised to provide a possibility of having a dietitian involved, so he can have a better diet to follow, instructions to follow. Yeah, he was quite receptive, and he wants to follow the instructions for sure. I was also thinking about increasing his time for treatment to 4 hours. He might be beneficiated with this treatment of 4 hours instead of 3. Okay. Yeah, possibly we will consider it also to reduce or to cooler the dialysate. Yeah. Yeah, he has been able to remove 55 to 60 according to the lab results. So minimum should be 60. I think that will be helpful. Probably to do the sodium profile ultrafiltration mirror. Excellent. And finally, he mentioned that one of his medication for blood pressure has been removed. Would you like to continue with that medication? Same dose? Okay, Dr. Key, expect the orders to be faxed to me so we can start with the treatment. Thank you.